Hi everybody, so it's Chat with Caroline time again. Thanks ever so much for the feedback that I've received on the first chat with Caroline, and we've just been spending some time thinking about how we can make this live, and we're going to be trialling that in a couple of weeks. So it's going to be the 31st of July. I'll send a message out to everybody, and I'm really then wanting to try and get some of the ideas have been that let's try and theme it and invite different people to have a chat with me. So that's great. Keep your ideas coming in, and the feedback I've had is broadly really positive. So that's great, and thanks ever so much. So the last couple of weeks have been extremely busy. There's been some really great highlights, but there's been some real challenges for us as well. We're definitely on an improvement trajectory and a transformation programme as a trust. So last week we had the national team who visited us, Tim Kendall, who's the National Clinical Director of Mental Health. He brought his team with him. We had a really great clinical meeting as the second part of his visit, and thank you to everybody who came, and certainly he was really impressed with the quality and depth of people's thoughts and ideas for improvement. So really well done. Second thing to say is thank you so very much to everybody who has impacted on the reduction we've had in the 12-hour breaches in our urgent care mental health sites. So really, really grateful to people. Please keep up the focus and effort. We've also had some headline feedback back from the CQC. Really well done to our dental services and our children's inpatient services. And as I guess anticipated, we really have got some concerns from the CQC about our adult acute pathway. In the next week or so, we are going to have to be making some difficult decisions about what we're going to be doing about our mental health decision units. That really is an area of concern for the CQC. And equally, our 136 suites and keeping people for too long in those suites. As you know, we've been working collaboratively with all of our partners, including our commissioners, and we've been investing in new staff in our community teams and our crisis teams. And at the moment, we're urgently planning how we can open some more beds. Whilst we think that we've more or less got enough adult acute beds, we think we need some more learning disability and rehabilitation beds. So one of our real priorities as a trust, aligned with the national direction of travel, is really thinking through what is our future strategic direction. We've now got the NHS long-term plan, we've got an emerging strategy for our ICS, and now as a trust we need to refresh and develop collaboratively our new strategy. We spent some time as a board last month really thinking through what our headlines of our new strategy might look like, and we spent some time in the Engage session last week with our senior leaders. Jo Moore is our Director of Strategy and Partnerships, is leading this work, and she'll very soon be sending out dates for everyone to get involved in helping us to think through what should our future direction of travel be. So please look out for that. Community services is a really important area for us. I had a fantastic invite to a workshop that I visited a few days ago with the senior leaders of our physical health community services. Part of the feedback they gave me is from the Engage event, they felt that we were focusing a lot on mental health and learning disabilities, which I completely understand how that might be perceived in terms of the priority for community services. Now obviously the Community and Wellbeing Network also manage our learning disability services, and that is of a very high priority for us, as I talked about in my last chat. But our community services, there's so much work for us to be doing, and it was fabulous listening to the great work they are doing. We need to be working really closely with our partners, with the emerging primary care networks and all of our other partners in our integrated care partnerships. I was really pleased this week to meet with Blackpool Council, Chief Executive and Director of Social Care, very positive about how we need to work really closely together and how important our partnership is for our communities and our service users and carers. The Listening into Action progress has been really ramping up, and I'm delighted, and thank you to everybody. So we've been delighted this week that we've appointed 2 new people to the team. So 2 new consultants in Gareth and Mark. I think comms have already gone out around that. So we now have a team of 4 clinicians who are leading our Listening into Action programme. Please engage in completing the pulse check. It's going to give us the biggest insight into what are the things that you want to see changing and really help us on our next stage of our transformation journey. And then just before I come to the questions that people have posed, and thank you to everybody that has, I just wanted to say a really big thank you again to the Community and Wellbeing Network for the work they've done, really importantly, in improving the opportunities for people to choose to die at home. And they've really made significant progress, really important. So we now come to the questions time, and thank you to everybody for sending in the questions that you have done. We've had 10 this week. Some of them I'll be able to answer directly. Some of them we'll need to communicate with you separately. So the first question is about somebody's maternity leave cover. Really important that we value and support people to have the leave they need when they're having children. I've asked Deb as our head of HR to respond directly to the person who has made this query. Second one is about difficulty in booking rooms in Lancaster and Blackpool for both young people and adults. I'd really appreciate it if whoever that is could contact me directly and give me a little bit more detail, then I can see what we can do to help. It's really important, again, that people have the clinical space to see people in a timely way. Although it's also important to see people in their homes. But if you can contact me directly, that'll be really helpful. Third one, a really insightful question and really important, is about are people going to receive training reassessing and managing clinical risk, given the issues we've got that I've talked about previously around clinical risk taking. I've been with the consultant body this very morning, been talking about this very topic, and we absolutely will be having multidisciplinary clinical risk training alongside lots of other support and development around this. So absolutely. The fourth is about that we haven't got our clinical pathways in the right place. And this is the work that we are about to embark and start with NTW, Northumberland, Tyne and Wear, who'll be helping us in redesigning our clinical pathways, starting with our adult acute pathways. So again, a really important question, and thank you. Fifth question is about when are we going to become smoke-free? So if you remember, I answered that question last week, so hopefully that gives an answer to that. If it doesn't, then please contact me directly and I'll see how I can help. Sixth question is a question around are older adult services going to merge with adult services? And certainly at the moment we don't have that as a plan. And this is something that people thought that might happen as a result of the merger with Cumbria services coming across. Whilst we're really keen to explore the possibility of moving into ICP areas, we don't have any plans to merge older adult and adult services. We want teams to work closely together in localities, but not merge at this stage. Seventh one is about a very specific question about admin team. So again, I'm going to respond to that person directly about contracting and the hours that people are working. The eighth one is about are there plans to improve the Trustnet? And communications is a really important area for me, something that we're really pleased to have such a great comms team. We're boosting that. We've already got a new interim strategic support from a neighbouring trust in Chris Hughes, who's helping us with comms. We'll soon be going out for a substantive advert for a director of comms, and certainly the improvement of all of our communications, including our Trustnet, will be part of the plans. We have already started to make some improvements, so again, a really good question and really important. The ninth one is around our governance meetings and can we streamline some of these governance meetings. A bit difficult for me to understand that in its breadth, so I'm not sure what that particularly relates to. Obviously, as a new chief executive coming in, I'm looking at all of our meetings that I'm certainly relating to. But again, if somebody wants to give me any more details around that, I might be able to help a little bit more. And then finally, a really important question, asking what are our plans for adult community learning disability teams going forward? And as I think I discussed last week, we're working very hard with our commissioners rapidly on redesigning and enhancing our learning disability pathways. So we need some inpatient beds for people in Lancashire, we need intensive home treatment support, and that absolutely needs to align with our current adult learning disability teams. So a lot of work and transformation that's going to go on there, and really grateful for people's help and support with that. So that's the end of my chat with Caroline. Do remember to zone in on the 31st of July and let's trial how a live showing goes. Thank you very much indeed.